All right, we begin here. Today is World Malaria Day, and there's some good news in the fight against the disease. A potential new malaria vaccine has proved highly effective in a trial in babies in Africa. This points to the vaccine one day possibly helping reduce the death toll from the mosquito-borne disease. It kills up to 500,000 children per year.
Scientists around the world have been working for decades to develop a vaccine to prevent the deadly disease malaria. They may have finally had a breakthrough. A shot has been developed by a team of scientists, directed by one of the lead researchers behind the Oxford AstraZeneca COVID-19 vaccine. And it is proving highly effective in a trial in babies in Africa. The complex infection caused by a parasite carried in the saliva of mosquitoes kills up to 500,000 young children a year. Researchers say the candidate vaccine has shown up to 77% efficacy in a year-long trial of 450 children in Burkina Faso. Adrian Hill is the director of Oxford's Jenner Institute.
So 77% is the highest yet, and could really add to the existing tools that we use to control malaria, meaning bed nets, insecticide spraying, and giving children drugs to kill the malaria parasite during the peak of the transmission season. The problem is that we're using all those tools today and have been for some years. And since about 2015, there has been no reduction in the overall mortality from malaria in Africa.
The world's first and only licensed malaria vaccine, developed by GlaxoSmithKline, is only partially effective at around 30%. The team now plans to conduct final stage trials in some 4,800 children in 4 African countries.
Right, well, the World Health Organization has called for renewed efforts to eliminate malaria. The appeal coincides with World Malaria Day. The disease kills more than 400,000 people a year, most of them being children. Let's discuss this further. We're now joined via Zoom by Emmanuel Lampaert, who is MSF's coordinator of operations for Central Africa. Sir, thank you so very much for being with us here on SABC News this afternoon.
Thank you, ma'am.
And just, with the global efforts to control and possibly end malaria, it seems that, they've been obviously quite affected by COVID-19. Can you talk to us about the extent at which this pandemic has kind of, affected or maybe even prevented, efforts to curb malaria?
Thanks. It's a good opportunity to recall that every year more than 200 million malaria cases are notified worldwide, killing close to 400,000 people every year.
Yeah.
And the vast majority are children under the age of 5, and over 90% of these cases and deaths occur on the African continent. The ripple effect, this is what we call it, caused by the attention and the investments done on COVID should not prevent that this for ages known disease with unfortunately still more than over 400,000 children being killed needs to a continuous engagement by all in order to maintain the fight against malaria.
Yeah, and let's talk about how far we are in terms of this fight against malaria. Are we far from realizing a malaria-free world? Interestingly, when I opened my question, I spoke about possibly ending malaria, but I wonder if it is possible to end malaria. And perhaps on the back of that, if you can talk to us about this potential new malaria vaccine that is set to really make a huge impact and difference in terms of those efforts that are being made to possibly end malaria.
It is noteworthy, and in the introduction you mentioned it, a first trial with above the 75% cutoff, so all are welcome. While malaria vaccine pilot programs are ongoing in some of the countries on the African continent, Currently, prevention still relies on the use of mosquito nets, therapeutics, the spraying of insecticides, and the access to care and diagnostics. And unfortunately, in terms of access, there are still important barriers, being it financial barriers, being it community barriers. And a lot of our teams and the community health workers, which, by the way, we salute through this opportunity, they are still confronted with the consequences of late referrals. There are still a lot of rural communities where the different barriers in terms of access to care are present. And unfortunately, prevention, which is still better than curing, is not sufficiently implemented. So I was mentioning the ripple effect due to the COVID pandemic ongoing. These numbers that we have tried to share should call for an intensification and a continuation of the fight, of which is still a killing disease, and the binding of all the available tools should engage us all one day to see zero malaria in the world and, of course, on the African continent.
Emmanuel, very interestingly, you talk about rural communities, and one can't help but to notice the fact that malaria generally does hit in those particular areas that are, impoverished, and as you put it, the rural communities. Why is that the case? I mean, you don't often or sort of hear a lot of cases of malaria in less impoverished areas or the urban areas, so to speak. What is, what have you observed over the years, I mean, as the MSF team?
Well, what we see in rural communities is, of course, linked to environmental health, property, the knowledge and the understanding, the sensitization, how to have clean environments, clean housing, clean passes, linked to the vector control. And it all starts with that. And then linked, of course, with the linkage to care. I would like to take the opportunity to just share with you the example of Burundi, where malaria is the first cause of death amongst children, and where MSF, in good collaboration with the Ministry of Health, has tried to intensify malaria prevention and curative activities in several of these rural communities. And what we have seen, combining different tools, including the spraying of insecticide, we have seen an 80% decrease of malaria notification, hence complicated cases, hence deaths. And I've seen this myself in places like Ruyigi, Kinyinya, rural areas of Burundi, where when we compared 1 year to another, we saw the hospital beds almost empty. And this is motivating, this is engaging, but the first actor are these rural communities, and we need the champions, community champions that can enhance the engagement by the rural communities.
Yeah, and a day like World AIDS Day, as we commemorate it today, how are we meant to commemorate, but also continue to show the kind of efforts that are being put in terms of ending malaria, or fighting malaria, rather? I mean, how do we celebrate or commemorate a day like this? I mean, we have all sorts of days to commemorate certain things, and I just always wonder, and then what does the day actually then mean, especially for those in those areas that, where malaria is a big issue?
Well, I would say there are different parts in the story, and a day is first of all a momentum to thank community health workers, to thank our teams on ground, and through these thanking, appealing them to continue and intensify the effort. But it's also an opportunity to shed light on what is still an important morbidity and mortality factor, and through that, calling upon donors, calling upon state authorities, calling upon scientific community and actors together with the ministries of health to continue also to put efforts into this fight, hence maintaining the goal of one day assisting to zero malaria in the world.
All right. Thank you so very much for being with us here on SABC News. We appreciate your time, sir, and thanks for the efforts and the work that you're doing. All right.
Thank you, ma'am. All the best.
Thank you. That is Emmanuel Lampaert speaking to us from Kenya as we commemorate World Malaria Day today. All right, we're going to take a short